Hello everyone, welcome back to my YouTube channel. Today we are going to discuss about the muscle name is gluteus medius. Okay, so let's start. Its origin point is you all know that external surface of the ilium, okay, that is between the anterior and posterior gluteal lines, and insertion point is lateral surface of the greater trochanter of the femur. Okay, lateral surface of the greater trochanter of the femur. So you all know that gluteus maximus, gluteus minimus and medius, all muscles actually originate and inserts in the same point, that is gluteal surface, and insertion to the greater trochanter of the femur. So remember this for all the three muscles. So next one is nerve supply. So this gluteus medius is supplied by the superior gluteal nerve, that is L5, L5, L4 and S1. So then artery is supplied by the superior gluteal artery, superior gluteal nerve and superior gluteal artery. Then action, it abducts the hip and medially, that is internally rotates the hip and stabilizes the pelvis during walking and prevents a pelvic drop during single leg stance and all. Okay, then you can see this muscle also do his work while walking, running, climbing stairs, standing in one leg, or sidestepping or maintaining balance. These muscle helps. Okay, so this is about nerve supply, blood supply, actions and everyday activities. So next part is applied aspect, that is applied anatomy. So I gave you some of the point. First one is a trend line work sign. So weakness or the paralysis of this muscle, that is gluteus medius, may causes the pelvis to drop on the opposite side, okay, while standing in one leg. So you can see that. And trend line work gait, if it's there in, if there is a Trendelenburg sign, means there should be a Trendelenburg gait, right? In the weakness during walking, you can see. Then third one is important in pelvic stability, because this muscle also helps a very powerful role by stabilizing the pelvis. Okay, so weakness of this muscle may leads to uh, imbalance the pelvic stability. So common in hip pathologies, next one is that is weakness or dysfunction of the gluteus medius is associated with conditions like hip osteoarthritis or any patellofemoral patellofemoral pain or low back pain and IT band syndrome. This may cause also weakness in this muscle. So next is post-surgical importance, that is damage to this superior gluteal nerve, okay, because it supplies to this muscle, right? So if any damage to that superior gluteal nerve during any hip surgeries can cause the weakness of this muscle, that is gluteus medius. It's not only this muscle, also the muscle of gluteus muscles, then this may leads to weakness in this muscle. So these are all some of the applied aspect. Yeah. Next is special test. So special test, I gave only mentioned here two. Okay, there are so many special tests. First one is a Trendelenburg test. Its purpose to assess the strength of the gluteus medius and superior gluteal nerve. So if the test is normal, then pelvis remains in the level while standing in one leg. I already said this test in before previous videos. So in this video I'll only explain the positive and negative factors. So if the test is positive, pelvic drops on the opposite side while you stand in one leg. Okay, so next is a manual muscle test, that is MMT. So its purpose to test the strength of the gluteus medius, that is hip abduction muscles. So position of this patient should be in the side lying with the bottom leg slightly flexed in stability. Then examiner position, that is a physio's position should be standing in front of the patient or in back was also done, is okay. In procedure, that is nothing, a patient abducts the hip with that is lifting in the top leg. Then examiner applies downward resistance if towards the ankle. So if they are not able to hold it, or the contraction, if you see any movement or no movement, these are all should be there in by the grades. Okay, grade 1, 2, 3, 4 and 5. So okay, these two are the special test. So we are done with all the origin, insertion, nerve supply, blood supply, action, daily activities, and applied aspects, special test, everything of this muscle. So let's learn how to remember them. The mnemonic I got here is Sagar abducts the abducts and stabilizes the pelvis. Okay, just remember the Sagar. Okay, Sagar means like S stands for the stabilization the pelvis during walking, like and A is about its action, that is abduction. It abducts the hip. And G for gluteus medius, which muscle? This gluteus medius muscle, and acts in a medial rotation of the hip also. And R is a resistance, that is excessive abduction of the hip. Okay, it resists the excessive abduction of the hip also. So easily even to remember Sagar. If you want to remember more, then remember the message Sagar abducts and stabilizes the pelvis. Okay, so remember this mnemonic for if you can remember. Otherwise, no need. Everything is done right now, so let's revise them. Okay, the muscle we are studying is gluteus medius. So its origin point is external, that is gluteal surface of the ilium, and insertion point is a lateral surface of the greater trochanter of the femur. Just remember, greater trochanter of the femur is more than enough. Then nerve supply, it's supplied by the superior gluteal nerve, and arterial supply, it's supplied by the superior gluteal artery. Just the difference is nerve and artery in these words. Then the action, it abducts the hip, because these are the hip abductors. Okay, it abducts the hip and medially rotates the hip and stabilizes the pelvis while walking, and also prevent the pelvic drop during single leg stance. Then the activities, that daily everyday activities, this muscle help while walking, running, climbing stairs, standing in one leg, a side, stepping, or maintaining any balances. So applied anatomy already said weakness causes Trendelenburg gait, and a superior gluteal nerve injury causes by a pelvic drop and hip instability, and also the damage to superior gluteal nerve cause this muscle weakness. Then special test, already said two tests, that is Trendelenburg test and manual muscle testing, that is MMT for hip abduction. And mnemonic I said Sagar. If you can remember this. S for stands for stabilizes the pelvis, and A stands for abducts the hip, G for gluteus medius, and A acts in a medial rotation, and R resists the excessive hip abduction movement. So this is all about this muscle, gluteus medius. In the next video, I'll come with next muscle, that is tensor fasciae lata, which is also group of the gluteal muscles. So okay, thank you everyone for watching this video. See you in the next video.